Hello, everyone, and thank you so much for joining ADAA in McLean's Hospital webinar, How to Recognize and Support Children with Selective Mutism and/or Social Anxiety. We're going to answer some of your questions today. We have a few set up as well, so please feel free if you're joining us live to put your questions in the chat. If you are live, we also have closed captioning available for those who require it to help with your participation during the session. I would like to just quickly hop right in and welcome our wonderful presenter, Dr. Jacqueline Sperling, who is a clinical psychologist, faculty at Harvard Medical School, and co-founder and co-program director of the McLean Anxiety Mastery Program at McLean Hospital. She is also an author of an amazing book called Find Your Fears, How to Put Social Anxiety in Its Place, which I think we can all use for all ages. Dr. Sperling, thank you so much for being here today. I just would love to kind of get us started and hop right in as we're accepting audience questions. For the parents and caregivers who are joining us today, what are the signs and symptoms a parent should watch for to recognize if their child might be suffering from selective mutism or social anxiety?
Sure, and also just want to say thank you so much for having this introduction. So a child experiencing symptoms of selective mutism has the capacity to talk, but has stopped talking in social situations, typically those outside the home, for at least a month. Children may be talkative with family members and close friends, but they do not speak with others. A child with social anxiety disorder symptoms typically worries about being judged and embarrassed to the point that their worries interfere with their lives for at least 6 months. Children may avoid activities that involve interacting with or being seen or heard by others, especially their peers. For example, a child may avoid participating in class, going to extracurricular activities, being active in front of others, attending social plans, attending birthday parties, ordering in restaurants, eating in front of others, using public restrooms, giving speeches, making phone calls, texting peers, and more. Even before these symptoms emerge, parents might notice that children have what is called a behaviorally inhibited temperament. This temperament is not always, but has been associated with the subsequent development of social anxiety symptoms. Children with the temperament may cling to parents when facing a new situation and fear or be reticent to try new experiences, not just social ones.
That makes sense. So can a child have selective mutism and not have social anxiety?
There's a significant overlap. I'd say that's typically the majority of the cases where you would see that it's selective mutism and also social anxiety disorder. That's not to say that everyone who has social anxiety disorder has selective mutism, though. The age of onset for selective mutism is earlier than for those with social anxiety disorder.
That makes sense. Thank you. Can you explain what the causes might be of selective mutism or social anxiety in children?
Children may be born with a genetic predisposition to experiencing an anxiety disorder, and certain stressors in the environment may amplify symptoms, such as starting a new school or bullying. Before I share the next piece, I want to be clear that parents are not to blame for the symptoms. And the information is to empower caregivers to think about ways that they can shift their behavior to encourage changes in their children. For example, research has found that certain parenting practices, such as modeling avoidance of social interactions, may strengthen social anxiety symptoms in children. If they see you avoid, then they may learn that a situation is threatening and shouldn't be approached. In addition, a combination of the behavioral inhibition that I mentioned previously and experiencing a significant amount of criticism, control, or protection from a caregiver has been associated with subsequent development of social anxiety symptoms.
I think we got a question that comes in, and I would like to just kind of continue this conversation. What role should a parent play if a child is struggling? And what's the line that they're walking between reinforcement and support?
That's a great question. It's a delicate balance. You want to make sure that you are validating, you are acknowledging how a child is feeling without agreeing or without disagreeing, but you're showing that you hear them. And at the same time, you want to help them see that anxiety is sounding a false alarm. And so you want to help children see that actually what's happening is that there isn't a threat to their safety, and find ways for them to help them gradually start to approach their fears. And so parents can be this cheerleader and encourager. Ideally, and I want to say that this is ideal because I recognize the state of affairs right now where it's exceptionally difficult to have access to mental health support. So if someone, we're in treatment, ideally I like to take parents, out of the line of fire is what I say, so that to have the clinician design the interventions that the child is gradually, working on, and then the parent is just like cheering them on and really reinforcing with praise any steps forward, just their efforts. But if that's not possible, then I'm happy to talk about how to help your child when it's those of you at home.
That's a great question. So for a parent who's seeing that their child is exhibiting these symptoms, when do they know it's time to seek professional support?
So speaking with the child's pediatrician can be a helpful first step to discuss local treatment officer. Just want to say that, like, what are the signs before you even get that? I would say that, you can look for, oh, sorry, just the message was coming to me. You can look for just like that behavioral inhibition that I was saying, that like if children are sort of like clinging to you and they don't want to try new experiences, or if you're looking for a child, looking for things where like they're starting to avoid experiences or not doing their daily activities, those are signs where support may be useful. Any signs where there might be any type of avoidance or reticence to try things. And I wouldn't assume that any behavior is a phase. Even if you're unsure, the treatment that's available isn't invasive and it really offers life skills. So it's not going to harm your child if you're not necessarily sure if they meet full criteria for an anxiety disorder.
How might a parent communicate with their child that they're bringing them to see a professional to talk about these feelings, and how might they put that in a way that doesn't feel overwhelming or scary?
I always want to lead with and just say, with like concern, to just say like there to support them, that it's like not a threat, and that just say like, describe what you've been seeing. Like, sometimes it seems like those worries have been like really bossy and making it really hard to do the things that you really want to do, right? Like, so these kids, like, they really want to do these things that the anxiety is making it hard to do, like be with their friends, do their extracurricular activities, participate in school. And you can say that, you absolutely deserve to be able to do those things, and there's help that's out there. And you know what? There are people who do that. And, some people, they were like going to a doctor, there are going to be shots, like no shots involved, right? It's just you're going to talk about your feelings and you're going to learn some tools to help you boss back those worries. And there you get to be in charge instead of the worries. That would be more for a younger child. If you're talking to a teen, you can make that more for the older child, and developmentally appropriate. And just really like acknowledge their desire for independence too, and just sort of let them know that's like no one's going to force you to do anything. It's really a collaborative approach in this treatment, and to help them decide like what feels like an approachable step, and to have that support to help build some mastery.
Yeah, I think no matter what age you are, you want to be the boss of your own mind and not the other way around. We had a question come in regarding selective mutism in the role of bilingualism, and how someone who speaks another language, that might impact their ability to speak out in public, and how that might impact them. And is there a discrepancy in
So that's a really good question. So a distinguishing factor for selective mutism is that someone actually has the language tools to be able to speak. Like when someone's learning a new language, right, it might make them nervous, perhaps that they don't know all the words or what to say in that moment. Kids with selective mutism have the capacity to speak and the language, and you may see them be chatterboxes at home. It's just that when they're in another setting, they stop talking. And so that was where the difference was. If someone is, learning another language, you might try to find out like, what is it actually that they need? It may be sort of like additional support in learning the tools, or just some additional practice to learn that they can do it.
That makes sense. Thank you. Are there specific strategies or techniques that you would recommend for parents or caregivers to provide their children to help manage their anxiety or their selective mutism?
Mm-hmm. Parents can model being brave, such as asking a stranger for directions, Also, although parental instincts may pull you to try to make your child feel less distressed in a situation and just answer for them, it's important to remember what I mentioned earlier that anxiety is sounding a false alarm in situations that do not involve threats to one's safety. In those situations, parents can refrain from accommodating or speaking for their children. It may be uncomfortable to sit there while a child does not respond to someone or refuses to order for themselves at a restaurant, and the avoidance will strengthen if you do what the anxiety wants and not what the child needs. Also, for children with selective mutism, it can be helpful to offer forced choice questions instead of questions that could allow a child to nod or shake their head in response. For example, you could say, "Do you want pizza or pasta for dinner?" Instead of, "Do you want pizza for dinner? How about pasta for dinner?" With the former, with the two options, the child has to speak to answer. With the latter, the child does not. Offering two options at once instead creates an environment that makes it less supportive of avoidance. And as I mentioned earlier, it's also important to partner with children to help them brainstorm steps that they gradually can take to address their fears and build a sense of mastery. Have them be a part of the process. So have children pick a behavior with which to start to give a sense of control and to facilitate willingness. After practicing a behavior a couple times, the child can select a slightly more challenging behavior that may feel more approachable after learning that they could do the preceding behavior. And anytime a child demonstrates bravery, praise the effort and not the outcome to provide attention to the behaviors of which you want to see more, which is them trying. And again, if you're working with teens, establishing even more of a sense of autonomy will be really key for them. And yes, ideally, if someone has a mental health condition to take you out of the line of fire, then you would not be necessarily designing the hierarchy for help them gradually face their fears. But when that's not available, this can be a step that's possible.
That makes sense. Pasta for dinner would be great, Dr. Sperling. We have an attendee who has a daughter in college, and she just got diagnosed with social anxiety. Can you speak to how long it takes for treatment to kind of show results?
Okay. And first of all, I'm so sorry for the challenges that your young adult child is experiencing. And I'm relieved that now your young adult child knows that there's a name for what they're experiencing. They're certainly not alone, and it is addressable. Um, I would say, so this is probably not the most satisfying answer, where there's not a fixed number of weeks where it's like, you do this for this many weeks and then you're good to go. It's a process. If someone were doing once a week, treatment, then you may be able, standard course CBT, cognitive behavioral therapy might be 3 to 4 months. But that being said, that's not to say that like you will not see any gains before then. And I also work in an intensive outpatient group-based treatment program where I see kids, for 4 days a week and that multiple hours in the afternoon for 4 weeks. And I would say like you start seeing gains very quickly because a month of that treatment is also about a year of outpatient treatment. So you can see kids really get back on track, or teens or young adults get back on track quite quickly. And just one thing to keep an eye out for is that the treatment trajectory, it's a bumpy road. It's not a linear, smooth, straight line. And so anxiety is a bully, and as soon as you start pushing back, it will try to retaliate with a vengeance and make you feel like you're back at the start, but you're not. You can't unlearn all the gains that have been made, and just keep that in mind. And any step forward is a reminder to your anxiety that you're taking control. So for the college student who may be starting treatment, just know that there's help out there. It's possible. Improvement is possible. You're brave for trying it. And just for expectations to know that like if you hit a bump in the road, that's expected.
Okay. Are there common ages where social anxiety or selective mutism are more often seen? And does it kind of present itself differently at different ages?
That's my pleasure. Thank you. So selective mutism, the age of onset typically is earlier. So you might see as like someone who's like, for example, like 5 years old or something like that, you might see the selective mutism start there. The average age of onset for social anxiety disorder is around like 13 years old. That being said, usually people will say the social anxiety didn't show up out of the blue, or this like mutism didn't show it out of the blue, that there may be this behaviorally inhibited temperament, or someone was always kind of like slow to warm up or reticent to try things. So they saw signs that there might just be a stressor that makes something exacerbated, or turn on even more. And I would say the reason why also you might see social anxiety show up to the point where it's interfering later is around age 13 is in adolescence, peers become much more important to teens. And so that's where I start to say they start to care more about what other people think, and being judged and embarrassed, and they're establishing their identity, who they are, trying to fit in. And I probably don't have to tell all of you that middle school is not a walk in the park. So, you know, at that age too, where there's just so much with which they're contending.
That makes sense. Um, is there a difference for those who are 13-year-olds? How do they determine introversion and just being shy to social anxiety?
Sure. Right, as I mentioned, like some people may have the temperament where they may be more shy or slow to warm up, but they don't necessarily have social anxiety disorder. The key piece there is to think about, are the worries starting to get in the way of daily life? Are they stopping someone from participating in class? Are they stopping someone from socializing? Are they stopping someone from going out in public or participating in activities? Anything where the worries are stopping them from doing something, then that's a sign where it's like, it's more than just someone's like, yeah, I know, I just kind of like, give me a minute and I'll warm up. But they eventually do something. It's more sort of like someone's deciding not to, but they tend to avoid because the anxiety is so stressful.
How can parents and teachers partner together? Um, as you mentioned before, someone might be a chatterbox at home, but if they're struggling at school, how can that community come together in terms of treatment?
Consistency and united fronts are key. It can be helpful to inform all adults who interact with your child about techniques to encourage bravery, such as asking forced choice questions and being patient while waiting until someone responds. It also can be helpful in generating compassion. Children with selective mutism and or social anxiety disorder may be viewed as oppositional or looking for attention when those are not the case. In fact, children with selective mutism and or social anxiety disorder do not want attention on them. Helping those around your children understand what's driving the avoidance can help them be more understanding.
I think that's a really great point. For those who are suffering or dealing with selective mutism, those children, how might they be advocates for themselves? What tools can their parents give them to so they are able to find a way to communicate their emotions, and if they're having trouble communicating or sharing those feelings, how we cross that boundary?
To help those who are experiencing selective mutism or social anxiety advocate for themselves?
Yeah.
That's a very good question, because that in and of itself is a huge challenge for them, just in terms of being able to speak for themselves. So I would say that I would, you know, in any way, just check in with your child and find out like what would be most helpful for them. You know, it's a very young child, they might not know, but sort of think about like, let's think about what steps, and you can brainstorm ideas and let them pick. Like, what you want to make sure is that being supportive of your child and not the anxiety and the avoidance. So if they say like, well, it'd be really helpful for me if you told my teacher that not to call on me in class, because that's supporting the avoidance and the anxiety and not the child. And it's sort of like, I'm having a hard time letting my teacher know that this is difficult for me. Then we can think about, let's find steps to help you approach that. And maybe like, baby step, they could like role play with you, they could draft an email and then read out loud to you, like any which way to help them practice to approach the actual situation, but that you don't do it for them.
Is selective mutism a type of social anxiety?
It's a great question. It's a separate diagnosis. I would say there's people with selective mutism often have social anxiety disorder, significant what we call comorbidity or co-occurring. And they're
If
not talking because that fear of judgment.
sorry, I didn't mean to cut you off there. Uh, for adults who get social anxiety later in their lives, does the research show that there's a link to an earlier experience, or can it develop over time?
Yeah, it's something where, like I said, like someone may have this genetic vulnerability, and it may just be that environmental stressor sets it off later. So it could be this, like if someone, you know, move schools in high school, but or if that's different than moving a school in elementary school, or the bullying happens later, or it could be even just stressful, like there's a school play, or there's sophomore year in high school and it's persuasion speech requirements, and so like there can be different things that happen along the way that make it show up later. It just depends where the stressors may be. And I would say that, the pandemic also has made it where kids were often out of practice too, right? Because when they were isolating, for their physical safety, they had fewer opportunities to practice in person. And I think, often going back into in-person interactions and then not wearing masks, that was, can see an increase in social anxiety because they're feeling out of practice, uncomfortable.
Where does tech and social media come into play? Is it a help or a hindrance?
Well, these are all really great questions. So social media is not all bad. It's not all good. There are different types of social media use, and different types of use have been associated with different impacts on one's mental health. So they're self and other oriented, and active versus passive, and then those can interact. So as self and active type of use might be updating your profile picture. Those in and of themselves, like those actions, an action like that would not be associated, is not been associated with a negative impact on one's mood. However, other and passive oriented, so like scrolling through one's news feed, that kind of behavior has been associated with depression, anxiety, and body image concerns, particularly for those who identify as girls and for younger teenagers. And that's because it can create opportunities for comparison. And you don't see someone's entire life on social media typically, right? There are snippets, and people selectively choose what they're going to post, and they often use filters. And so it's not an accurate reflection of what one's life is like. And then you also can see someone gets more likes than you may like or get, and then maybe the comments are different. And so there are multiple opportunities for comparison that may negatively impact one's mood. So I don't think it's realistic to then be, because of this potential, negative impact, like just don't use social media, or to not do social media because of how pervasive it is, but to empower youth with information about how certain types of use may impact their mental health, and to give them the tools to help adjust it so that it doesn't make them feel worse. So one, for example, could do a self-assessment, rate their mood on a scale of 0 to 10, 10 being the most intensely they can experience emotions, 0 not at all. So I'm a 7 happy, I'm a 3 worried, I'm a 4 sad, however they're feeling before they use social media. Pay attention to what kinds of use in which they're engaging. Is it active, passive, self, other oriented? And then have them re-rate their mood afterward. And if they find that they feel sad or worried, matter, then it's like, like maybe there's something about my use here that's not making me feel good about myself. Let me see if there's something I can do about it. They can curate their newsfeed. They can still remain connected to people, but unfollow them. Unfollow, like mute their stories and their posts, so that they're still connected to them, but they're not seeing all of their updates. Just use social media to like send messages directly, to set up interactions that happen in real life. So you can, oh, look, our favorite restaurant is having a special, like, let's make plans to go meet up this weekend, to go support this place in our community. Like that can be a way, to use social media. And then redo the assessment, rate your mood before and after, and see if you start to not feel worse about yourself after using it. And then that might be for like a sweet spot for you.
Yeah. Children and teens, as we mentioned, so like social groups are super important. Um, can friends reinforce behavior by providing kind of a safe space for kids with social anxiety?
Oh, absolutely. It's common particularly for those with like selective mutism, where they may have a best friend and they're chatty with their best friend, and then their best friend becomes their mouthpiece for them. And so like they'll whisper into their best friend's ear, and then their best friend will speak for them. And it comes with like such kind intentions. They like, they're helping their best friend, right? And they want to support them. Young children don't know typically that that's reinforcing or strengthening the avoidance, the anxiety. And that's a big burden to carry as a young child. And so we want to make sure that they're not playing that role, and to help, teach the friends, just really acknowledge how kind and supportive they're being, and help them differentiate that doesn't like the worries and not their friend right then and there, and how to best support their friend. I'm going to support that way.
You mentioned CBT earlier. I was hoping you could talk a little bit more about the evidence-based treatments that are available.
So cognitive behavioral therapy, parent-child interaction therapy with selective mutism are evidence-based treatments, or treatments that have support from research. Those have been demonstrated to be effective. And if you're interested in learning more, as I mentioned, like pediatricians can be often a helpful first person to ask, to see if there are local treatment available options, and to see, maybe perhaps they have some providers to make referrals.
Thank you. Are there any techniques, someone asked, in terms of like breathing or self-calming or self-soothing techniques that you might recommend?
So relaxation exercises can be great. It just depends on when you're using them. So cognitive behavioral therapy with exposure and response prevention as a type of therapy where you're having children gradually face their fears and learn that they can handle the situations. And it's really important when they're facing their fears that they're at a dose where the children can learn, but also that they're not distracting themselves. You want their brains to be exposed to a little bit of anxiety, that bit of discomfort, and be like, oh, wait, it's either not as bad as I expected it to be, or you know what, that was as hard as I expected to be, even harder. And I learned that I could do it. That's really key. And if you're doing deep breathing exercises and trying to reduce the anxiety in that moment, that's sending a signal to the brain that it is dangerous and that you can't handle it, and distracting it from the learning experience that you can. So if you're going to do relaxation exercises, I suggest like an hour before an activity, like not right during an exposure, or if it's like helping you fall asleep, that can be a good time, just not during.
I think that's helpful. I want to be conscious of our time. We are kind of slowly wrapping up. Dr. Sperling, are there any kind of key takeaways that you would want someone to walk away with today?
Sure. So just first of all, I really salute all of you joining here today. Like, thank you for your interest, but it also just shows that you recognize that this is important and that you want to support other people. So I really appreciate that. And something I just really want to emphasize is that I would not assume anything is a phase. If you are concerned in any amount, I would contact, a pediatrician, just check in. As I mentioned, that the tools that are involved in these treatments, they are life skills. If you're human, they're helpful. So it's not going to hurt someone for them to be able to have access to some of these tools. And then also, certainly not alone. Anxiety disorders are the most common mental illnesses. You're absolutely not alone. And they are very, 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 very common, particularly now on the onset of the pandemic. So you're not alone. There's treatment that can help. And don't wait if you're concerned.
And just a final question, if someone is now thinking maybe they need to get their child or loved one help, what's the first step?
I would say a pediatrician, a healthcare provider, if someone mentioned they have a college student, so maybe an internist, whoever their primary care provider is, be helpful first step. ADAA also has a great list of resources in terms of providers who may be able to offer helpful treatment. There also are books available. Some people, particularly if someone has social anxiety, it may be hard for them to talk to people. So it doesn't have to be the book that I wrote. That ADA is a list of all, great list of other books that are available that can be resources and perhaps a starting point, not to replace treatment, but it may help them warm up to it.
Yeah, I think that's an important part. Dr. Sperling, I want to thank you so much for being here today. I'd just like to quickly see if I can get this up super fast. Let everyone know that if they are looking for support, ADA does have a Find Your Therapist tool with clinicians who provide evidence-based treatment. There are online support groups, maybe not quite right for the little ones, but for your teens or your college students. And there are a lot of amazing resources, webinars like this, blog posts, and personal stories where people come and share their experiences. And I think those make a great difference. Dr. Sperling, I want to thank you all for being here today. Thank you to all of our attendees. We hope to see everyone again soon.
Thank you so much. Thank you for having me. Thank you all for being here.